Last week we talked about shoulder problems in general, but what do you do if you don't get better without surgery? Dr. David Buchalter, an orthopedic surgeon and shoulder specialist with OrthoMaryland, is here to discuss how to get your shoulder better when surgery is needed. Good morning.
Good morning, Patrice.
Now, obviously, that's the last resort, I would think, to have to resort to the surgery.
Absolutely. We always go from more conservative, more non-operative measures to surgery only if patients don't get better for these elective procedures.
And so what is going on with the shoulder that those things wouldn't help and you would need the surgery?
Well, there are very common reasons people have shoulder surgery. One of the most common reasons I see in my practice are rotator cuff problems and rotator cuff tears. They tend not to heal by themselves, and patients oftentimes have significant pain and difficulty sleeping. Other times, young athletes tend to have recurrent shoulder dislocations, shoulder instability, where the shoulder just won't stay in place and they're not able to do things. And then there are the older patients with severe arthritis who oftentimes need to have a joint replacement.
All right, and age doesn't necessarily matter when it comes to that. My sister had the one where she had to get her shoulders to stay in place, and she was young.
Right, exactly. And that's what I was saying, is that with the younger patients, high school athletes, college athletes, I frequently see, they're not able to do the activities that young people like to do, especially sports, without the shoulder staying in place. The middle-aged patients, patients who injured themselves at work or with overuse tend to be the ones with rotator cuff problems, and it's the older, more elderly patients who have that severe arthritis and unremitting pain that end up getting a joint replacement for shoulder arthritis.
Okay, so once they do have the surgery, it typically, does that resolve whatever the issue was and they can recover and lead normal lives again? The
good news is shoulder surgery is very successful. These are different surgeries, but on balance, I would say 90%, and the literature backs this up, tend to have very good results and the desired outcome that they would like to have.
I know it's different types of surgeries, but what's the recovery process like and the length of time you're going to have to?
Well, the good news is that several of these surgeries can be done arthroscopically, and that can reduce the pain and reduce some of the complications. So oftentimes you have to wear a sling for a couple of weeks, even 4 to 6 weeks. I'm sure in your sister's case, where she was having recurrent dislocations, the idea was to keep things still for a while. And then physical therapy for progressive motion and strength. And it can take up to 6 months to really get back to where you want to be.
But the good news is you can get back to where you want to be.
You can get back there.
Doctor, thank you so much for coming in. We appreciate it.
Pleasure.
Well, coming up, some last-minute choice words from